Hi everyone, my name is Daniel Nwoke, and my health topic of focus is HIV, and I'll be walking you through HIV as a public health emergency and as a public health epidemic, and what I would need and the strategies I will try to imply towards making sure that HIV as a disease is being alleviated. Actually, investment in HIV prevention, diagnosis, and treatment remain essential from all perspectives, both the patient's perspective, the healthcare perspective, and the societal and public health perspective. As a matter of fact, since the beginning of the epidemic for HIV experts have noted the importance of having a plan that would be set. Also, this plan will set clear goals for United States and coordinate efforts so that we can address the epidemic across government agencies. The first of this kind of plan was the National HIV/AIDS Strategy, which was implemented in 2000. Looking at it, and also I will be looking at how it was credited to helping reduce the rates of new HIV. And who my first slide here, I am looking at. I listed out the health issues of focus. I left a little facts for HIV, so it's something due to time we'll go through later on. And the goal of my policy and my treatment goal that I'm looking for towards eradicating this disease of focus would be to improve the quality of life of HIV patients. I would want to reduce related morbidity and mortality. I want to see whereby prevention is being increased. And who do I need on my team to see that I achieve this? I actually need the government. I need the government to do four most important things to help me diagnose, treat, prevent, and aggressively have a government response. On the side of the diagnosis, I want a government initiative that will aim to reduce the number of people living with HIV, especially people who are unaware of their status. And as at last year, 2021, it is estimated that about 13% of people living with HIV do not even know they were infected, and that nearly 40% of these new infections in 2021 in someone who was unaware of their status. So the government will need to improve testing strategies, initiatives to increase access to HIV testing and target protocols. I want an initiative that will aim to ensure that everyone living with HIV is getting the treatment they desire. Uh, Anyone who is diagnosed with HIV should see a healthcare provider immediately, and they can be prescribed prophylactic exposure prophylaxis. On the prevention, I want to see more increase in the government looking to increase prevention efforts by increasing the exposure prophylaxis. It's called PrEP. And on the aggressive government policy, I want to see a government that will aim to improve public health response to new outbreak. So there will be new testing techniques and more sophisticated disease approach like the molecular surveillance, which will allow public health to pinpoint potential HIV outbreaks. And on my plans and programs of initiative, I'm looking at this on a national level, a state level, and a local level. On the national level, I'm looking at the government to initiate more programs like the Ready, Set, PrEP, and America's HIV epidemic analysis dashboard. This program has shown that patients can be able to have the PrEP medications delivered directly to their homes, or they can have it picked up at the doctor's office or the pharmacy. And what this is going to do is that with the whole barrier, so that more eligible patients can be able to access PrEP medications through federal funding. Then on the state level, I want to see state governments partner with the federal government towards bringing down HIV transmission. And on the local, whereby local communities can come together like churches, mosques, prison to increase HIV testing within their jurisdiction, and also see that HIV testing capacity is increased, especially on local level. And on the national HIV strategy, I had to look at draft this strategy because what I'm looking to do is that the national HIV strategy will help identify the priorities, help coordinate resources, and offer a clear plan for HIV prevention and care interventions. And what I'll be looking to do is to first of all prevent new infections. And preventing new infections, this strategy would look to increase the awareness of people's knowledge about HIV. You want to increase people knowing about their HIV status, implementation of safe and effective prevention interventions like the PrEP, and this will lead to increased diversity and capacity of healthcare delivery systems so that HIV can have more access to things around them. The next thing will be to improve HIV related outcomes. And what I mean by this is a strategy that will link people who have HIV directly to doctors or healthcare providers immediately after diagnosis. This will also remove barriers to HIV treatment so that people can have the boldness to seek care and not have to transmit it randomly. And it will also help identify those who are not in HIV care and engaged in proper HIV treatment and care. Then the next one will be to reduce HIV related disparity. This especially impacts Black neighborhoods, people of color, transgender, people of the LGBT community. And what I'm going to look at this strategy, we'll see that this strategy will acknowledge and seek to reduce the disparity as well as the stigma and discrimination, and also help address the policy issues both socially and structurally, and reduce and target the social determinants of health, which negatively impacts. I want to see a government policy that will help achieve an integrated effort among all parties, interested parties, whereby the government will be able to release fundings for HIV research, HIV medications, HIV treatment protocols, both at the public, private, academic level, and also in the local